I can see Mrs. Sherifat Mohamed Kamal is getting ready, getting into the speaker seat. How are you today?
I'm fine, thank you. Just
wonderful. Thank you so much just for jumping in. That is absolutely great.
Yes, because I was looking at starting just a couple of minutes past 12, but yes. It's of rearrangement.
You see, it's amazing what can happen, isn't it? Yes. Okay, you just tell me when you're ready.
Yeah, I'll be with you just a few more minutes.
Okie doke. I think in the meantime, I will have the utmost pleasure to actually introducing you. Mr. Sherifat Mohamed Kamal is going to talk about the medicine optimization in primary care and healthcare services. I think that also is quite a nice bridge over from our last speech that we had. Mrs. Sherif Mohamed Kamal, I hope I do pronounce your name correctly. You have complemented your pharmacy degree from Ahmadullah Bello University in Zaria, Kaduna State, Nigeria, and came to the UK to finish her overseas qualifying examinations at the University of Sunderland, and equivalent to an MPH pharmacy. You're currently working as a postgraduate studies in public health and independent prescribing, and you're specializing in HIV and sexual health, in medicine optimizations, minor alignment services, and patient-centered care. I think a very interesting topic, and as I said, is actually kind of a nice transition to the speech that we just heard. Okay, Mrs. Sherifat, I would like to hand over the stage to you, and thank you once again for jumping in. That's marvelous. Thank you so much.
It's all right. Thank you very much. Hello, everyone. Good afternoon from here in London. And I don't know, we're different timings all over the world. And I hope we are all keeping safe with COVID-19. And if you already have your vaccine, I hope people are taking their vaccines. At the same time, after you have taken your vaccine, I hope you're still wearing your masks, you're keeping safe distances and keeping the hygiene. Thank you very much for inviting me to this interesting edition of your conference. Unfortunately, we cannot meet face-to-face this time around, but virtually, I think we're still meeting. Today, I'm going to talk about medicine optimization in primary care and healthcare system. I am a pharmacist. I deal with medicine all my life of over 20-something years. So today we're going to look into how we can work together as healthcare professional and optimize medicine intake by our patients. I'm going to use some slides, and I hope I'm allowed to share my slide. Can you see my slide?
Yeah, absolutely great. Thank you.
Okay, good. So we're going to just go into medicine optimization in primary care and healthcare system. And this is going to, the aim of this talk is just to be able to see how we can work together, pharmacists, nurses, and doctors, and support our patient with the use of their medicine. And this will ensure patient safety at the same time, ensuring we have value of the medicine that we take and we give to our patients. So what do you know? Do you know that 1/4 of the population has a long-term condition and 1/4 of the over 60 have 2 or more long-term conditions? And since we have aging population, the use of multiple medications known as polypharmacy is increasing all over the world. Is that people are taking medication from over the counter, or they're taking multiple medication for multiple clinical conditions. Between 30 to 50% of medicine prescribed for long-term conditions are not taken as intended. People take medication, keep them at home, and they don't take them as patients, as doctors, as nurses, as prescribed. So all of these things implies that something is wrong somewhere, which is why the word medicine optimization has been used in England for the last couple of 2013, and we've been working so hard in different practices, hospital and GP practice, even within the community pharmacy, to work around medicine use review and see how we can get the best out of our medicine for our patients. So I'm going to do a lot of references in my slides, in my talks from the NHS England, the Royal Pharmaceutical Society, and the NICE guidelines on medicine optimization. So medicine optimization. Medicine optimization looks at the value with which we deliver, making sure that the medication that our patients are having are clinically effective and as well as cost effective. So now we're looking at the patient, at the same time, we're looking at the management side of the health system. So it's about ensuring people get the right choice of their medicine at the right time and are engaged in the use of the medication with their clinical team as well. So why do we need medicine optimization? As I've said earlier, we are talking about safety here. So medicine optimization by improving safety, adherence to treatment, and reduction of waste. So we can ensure safety for our patient, we can ensure adherence for our patient, even concordance, we can ensure that. And at the same time, we can reduce waste and save money if we have a very valid and highly implemented medicine optimization strategy in place. So what are the goals of medicine optimization? So if as an healthcare professional, or if as an healthcare system, what do we want to achieve? What are the goals? So the goals of medicine optimization is to help patients to improve their outcomes, take their medication correctly, avoid unnecessary medicines, reduce wastage of medicines, and improve medicine safety. What do we mean by all these goals? Improve their outcomes. What do I expect? And if someone is on high blood pressure medication or someone's on asthma inhalers, we want to see that when they start taking their medication, there's improvement. And they are not using 3 different medication for the same thing that are doing the same work. And take their medication correctly. We want to ensure that a patient that is prescribed to take his or her medication 3 times a day is not taking it 1 time a day. Or a patient that has been prescribed a medication has stopped their medication and we didn't even know about it. So we want to ensure that the patients are taking their medications correctly. Another goal of medicine optimization is to avoid unnecessary medicines. We don't want someone taking paracetamol and cocodamol together. And we don't want people taking diclofenac at the same time with ibuprofen together. So we want to be able to have efficient pain management strategy in place if you want to manage a person that is suffering from pain. So we want to avoid unnecessary medicine. Reduce wastage of medicine. Depending on the kind of health system that we have, whether here in UK, America, or where you are than there, we have to, as much as possible, reduce wastage of medicine. When patients are prescribed medication for 3 months, we want to ensure they have medication for 3 months. We don't want them to have extra medication where eventually it gets expired, they have to throw it away, or they are taking medication that is not even necessary for them. Because once we are able to reduce wastage of money, of medicine, we can save costs for patients, we can save costs for the economy, we can save costs for the government as well. So improve medicine safety. If we are able to have efficient medicine optimization plan in place, we can improve medicine safety. What do we mean by this? If a patient is taking a medication that is not working, if we have a efficient medicine optimization plan in place, we will be able to spot that this medication is not working, and we can have a system in place where we can review the medication. If we have a medicine review system in place, and we can change the medication with the clinicians, at the same time work with the patient to decide and talk about their medication, if it's working or is not working. So polypharmacy, this will bring us back to polypharmacy. What is polypharmacy? Polypharmacy is the concurrent use of multiple medications by one individual. as we know that as we have age medication and comorbidity set in, people have so many diseases and they have to have multiple medications. So when we look into polypharmacy and we look into medicine optimization, we can see an interlink in there. So polypharmacy is most defined as the use of 5 or more medication daily by an individual. You can see here, some of our elderly patients ask this pop-up that they put their medication together so that they don't forget. So they know what to take in the morning, maybe 5, in the afternoon they take 2, at night they take 1. So people on this type of medication needs to be properly monitored so that we can have high outcome with their therapy. So however, the definition of polypharmacy is still debated and can vary from 2 to 11 concurrent medications. Some studies are generally define polypharmacy as the use of multiple concurrent medication or simultaneous long-term use of different drugs by the same individual. So looking at polypharmacy and medicine optimization together, we will be able to really take in and take out some medication that are not needed by that patient anymore. So for example, if a patient is taking medication, he had a fall, an acute medication, is taking cocodamol, and is taking some amlodipine for his high blood pressure as well. So if the patient is now better, the patient doesn't have any pain anymore, we should be able to during our medication review, while we're trying to see the patient, we should be able to take the cocodamol or the painkiller out because that pain is no more there. So all of those things are the things that we'll have to look into when we're trying to optimize medicine in primary care. So what are the guiding principles of medicine optimization? So the Royal Pharmaceutical Society here has produced a good guidance detailing 4 guiding principles for medicine optimization. And this is readily available online. So all our nurses here from all over the world can benefit from this beautiful guidance from the Royal Pharmaceutical Society. And the aims are to understand the patient experience and so be able to use the medicine as safe as possible. So this particular document is available online, and all the healthcare professionals can access this, the nurses, the doctors, and the healthcare support team. And it's a very, very good document, and it has really, really supported us in practice. So this medicine optimization by the Royal Pharmaceutical Society guidance is aimed to improve outcomes and have 4 main principles. So the principle 1 is aimed to understand the patient experience. So, and this principle 2 is based on the choice of medicine. And principle 4, make medicines optimization part of the routine practice. And principle 3, principle 3 is to ensure that medicine use is as safe as possible. So I don't know how many time, I don't really have much time, okay. So if I need to just simply expatiate and explain each aspect of this principle in practice, principle 1, aim to understand the patient experience. We want to be able to know how the patient understand how the medication has come about. Did they really understand what the medication they're using, what is it for? Did they understand that, did they know when did they start taking that medicine? Have they changed their medicine? Did they have a track record of when they start, what has changed? What did they feel about the medicine they are taking? And if you look at the principle 2 of the medicine optimization strategy from the Royal Pharmaceutical Society of Great Britain, it says evidence-based choice of medicine. Can we evidence the medication the patient is taking? Did they just buy it over the counter? Is it a licensed medication? Is it unlicensed medication? So we have to be sure that this medication that the patient is using is evidence-based. And most of these things are based on patient-centered approach. We have to work with the patient to make a decision about the medication they are taking. It's not that the doctor will just come, you have to take it and just take it. It has to be a discussion within the patient and the clinician to agree on the treatment plan. And they have to understand the treatment plan. They have to understand the medication they are taking. So the principle 2 is so important to us, it's important to the healthcare system, and it's important to drug development in pharmacy practice, that there should be an evidence-based choice of medicine. So for a patient with asthma, we have to look at the guidelines of 8 different stages of management of asthma. If the patient is on high blood pressure medication, we have to look at the guidance that supports the medication the patient is using. If the patient is on COPD, or the patient has got some maybe sexually transmitted diseases, so we need to be able to have an evidence-based discussion, evidence-based that supports the use of the medication the patient is taking. And principle 3 is to ensure that the medicine used is as safe as possible. We want to be able to ensure with the patient that the medication, the dose of the medication, is indicated for the treatment that we're giving it for. We want to ensure that the medication is safe to take for that patient. As a patient got an allergic reaction to any of the ingredients in the medicine, so we need to be sure that the patient doesn't have any allergy reaction to that particular medicine. For example, people that have allergic reaction to penicillins. So we have to document, we have to know, we have to ask, and we have to consult with our patient and ask the right questions when doing consultation. As there as a clinician, as there as a pharmacist, as there as a nurse. So we should document, we should ask the right question before we implement any medication for our patient. So has he had any allergy reaction? Even with COVID-19, before we vaccinate, we have the question, have you had any anaphylaxis in the past? Have you had any reaction to vaccine in the past? This is part of pharmacy practice, an act of pharmacy practice that is very, very important. So we should ensure that whatever we are giving to a patient is as safe as possible. With COVID vaccine, we also ask patients, are you planning to get pregnant? Are you pregnant? Because we know as pharmacists that we don't have a robust data at the moment to support patients that are pregnant to have the vaccines. So well with other medications, we have to ensure that it's as safe as possible. So we have to ask the right question. And principle 4, make medicine optimization part of routine practice. So when we talk about medicine optimization, as I've said, is a sequential way, different ways that we have to put in place to support our patient that they are having the right medicine at the right time. So what we mean by when making medicine optimization part of our routine practice, we mean that it is a center of medicine use. It is a center of the practice, the hospital, the community pharmacist. Our patient, when they come in to ask for medicine, we are asking the right questions. We have been able to review their medicines. We have been able to tell them what the medicine is for. We have been able to ask them if there's any adverse reaction they've had before with any of the medication. We have been able to provide them the information to report on yellow pages or whichever way you have in your practice if they have any adverse reaction. We are able to give them an informed decision that whatever, just give me 1 minute. It's fine. So we have been able to sorry.
You're okay.
So we have been able, sorry, thank you. So we've been able to make, ensure, let the patient realize that everything that by the time they come in, they have all the information to support them. So even when they get home, they have contact details on who to call or where to find on website or what to do in case there's a problem with their medication. In England, we have what we call medicine use review, which is now structured medication use review, where we look into people with chronic medical conditions and they're taking more than 2 to 3 medications, and we see how we can support them, how we can see what is working, what's not working, how can we move this around. At the same time, we have in place what we call new medicine service. New medicine service is for patients that are taking some medications that are highly, we call them highly monitored tablets. So anybody that's starting that medication, we review them within 2 weeks. About they come in to see us, 3 times. We explain to them what the medication is, the likely side effect, if there's any issue, what to do. So in a week's time, we call them again to see how they are, so that we know that they don't have, is either they are improving or the situation is not changing or they have any reaction to that particular tablet. In this process, we'll be able to spot if the patient starting a new medication has a reaction to that particular medication. And if we call them the second week, we want to find out from the patient, is the medication working? If they said yes, then they go back to review with the GP. If there's a problem, we record it and send them back to their doctors for another review, maybe change the medication and things like that. And we always remind them if there's any adverse reaction to report that immediately. So those are the 4 key principles of the medicine optimization strategy from the Royal Pharmaceutical Society, and it's been implemented and it's very, very effective. So I would advise some of our clinicians here, maybe something you can borrow from, something you can read about, something that can support your healthcare system. So advice for healthcare professionals. What we can do, this is just my basic one, that what we need to be doing and what we can ensure we are able to do as clinicians is to make sure that our patients know what their medicines have been prescribed for. So we don't just want a situation where a clinician will just write a prescription and just give it to a patient. Oh, that is your prescription, go and get it from the pharmacy. We want a situation whereby you are giving a prescription to a patient, you are telling the patient, I'm giving you paracetamol for your headache. Take it 2-4 times a day. If it doesn't improve, go back, come back, do this and that. So if you are giving a patient for someone that have, I would say maybe just starting high blood pressure, for example, maybe amlodipine or something else, where we expect you to explain to the patient as a clinician or nurse that is monitoring a particular patient, maybe asthma as itself, that I'm giving you an amlodipine for your high blood pressure. This is a likelihood side effect that you see, but if you see anything that is not right, please call the doctor. We want the patient to know that this is my medication and I know this is for this. If a patient is given statins for cholesterol management, you want the patient to know that this particular tablet that I take every night, mostly take at night, is for my cholesterol. So we want the patient to understand what the medicine is for and why they are using that particular medication. Within this, we'll be able to have a very good outcomes from the use of our medicines. And the second thing I wrote here is make sure they are involved in the medicine use review and their care. It's the same thing I'm saying. They have to be involved so that they know what we are putting in as a clinicians and what they have to put in as a patient. With all this, if we work together, we'll be able to have a very effective, robust care for our patients. And what's the advice I've got for our organizations? We should empower our pharmacists to manage polypharmacy issues, medicine reviews, and medicine management. I don't know, whichever area we are in the world, we have to make effective use of our pharmacists. Our pharmacists are very educated, and they have wide knowledge about drugs and drug management. So it's very good if we can put structures in place to use our pharmacists effectively. We can attach pharmacists to a particular, in England, we have specialists, I decide to specialize in HIV and sexual health. We have our pharmacy that specializes in medicines. Some specializes in asthma, some specializes in so many areas. So when we have pharmacists that specializes in different areas, they'll be able to manage, and the patient will be able to come to them all of the time to review the medicine that they are using, and have a very effective outcome with the medications use and management. So when we look into medicine management, we know we have a lot of issues individually all over the world, drug management issues, stock, safety. We have to make use of the pharmacy for high good inventory. What I'm saying is abuse of medication. We should be able to manage medication if what is missing, why is he missing? We should ask that question. In a store, if you are managing a store within a pharmacy setting, and we want to ensure there's a safety within that particular setting, we have to be sure that we are stocking 20 packets of paracetamol. We have to be able to account for that 20 paracetamol. Where did it go? Who did we give it to? Which prescription goes out with that particular medication? So inventory, being able to account for what is going in and coming out in medicine management is very, very important for medicine safety and even patient safety as well, because we'll be able to monitor this particular medication that has been withdrawn from this, maybe there's an issue with the medication and it's being withdrawn generally. So we know if we have something in place that is monitoring what is going out, we know who that particular person was given that medication that needs to be withdrawn, and we can recall it immediately. So medicine management is a very integral aspect that every establishment, every pharmacy, every healthcare system has to put in place. And there should be a pharmacist there to be able to support what is going in and what is coming out. So with this, I'll look into control medications. Control medications are, morphines mostly, and they are mostly abused. And to be able to work on all over-the-counter medications as well. When we have a very high medicine management in place, we'll be able to control the level of drug abuse. At the same time, we have to support our pharmacists, train them, give them the power to be able to get involved in patient counseling and patient consultation. After every after you have given them their prescription or they have given medications to their patient. An effective counseling and medicine advice to a patient support the patient. They don't really abuse the medication. For example, someone that have a chronic, maybe I would say even acute pain, and you give that person maybe cocodamol, and you continue to have that pain. Instead of coming to the doctors to explain that the pain is not going away, they continue to take more and more and more. And we don't know, it's a risk. The patient doesn't know it's risking the blood system, the S system, and eventually they get addicted. So all of these medicine management issues, medicine optimization issues are very, very important to ensure patient safety within our system, within our patient, even within the hospital that we are. So those are the things that are so important for us that we have to look into. So make sure your system, your culture, your behaviors identify and support polypharmacy patients. So the way we speak to our patient, the way we counsel them, and the way we train our staff as well is very, very important so that we can support our patient and support the system that we work with. So keep the whole team. The whole team, when I mean the whole team, I mean not just the pharmacy team, I'm talking about the medical director, I'm talking about the doctors, I'm talking about the nurses, I'm talking about the healthcare assistants. Everybody has to understand what medicine is. Everybody has to understand medicine management, and everybody has to understand safety of medicine. It's very, very important for our patients.
Thank you very much.
Yeah, so thank you very much. And that is just, I'm very sorry. I know thank you very much for the opportunity. And this is just the last slide here. What are the areas that we're looking for research? And this will benefit some of us are in university, clinical areas. There are numerous questions and research gaps in arena, in polypharmacy and in pharmacy really that we need to walk through. So these are some areas of research that I'm sharing with you. And if you go into Royal Pharmaceutical Society website, and some of the NICE guidelines, all of these are there. And this will support the whole world and to be able to maintain safety within our organizations. So there's so many things in there. There's some evidence-based tool to help the healthcare professional to be more confident to stop medicine safety. What constitutes a high-quality medication review consultations by whom and where is the best place for structured medication reviews. So all of those things are areas of research. How are the healthcare professionals supported? How can we support them? How do we get engaged with our patient, the people, the community? We're in the area of COVID-19. Have we been able to support people? So all of those things are the area of research that we need to look into. What technologies are in place to support our clinicians? Do we have the right technology at the right time? Are we using the right technology for the right thing? So do we have enough equipment to support our healthcare professionals? What technologies do we need to help our patients or elderly patients? The doorstep boxes. How do we support our elderly patients? So all of those things are the things that we have to look into as an healthcare organization to support us as clinicians, support us as patients, support us as leaders of healthcare system. So thank you very much for this opportunity. And I hope that with this little talk, I've not been able to really substantiate it, we'll be able to support us as nurses, professionals in every day of our practice. Thank you very, very much.
Well, thank you. You certainly are very passionate about your subject. And I guess with the talk just before, it also shows very well the combination between patient education on this subject, plus also how to actually administer the drugs in the first place. Thank you so, so much for your interesting speech. Are there any other questions? Okay. So I guess you have been able to join us, Dr. Bhattacharya. You ready?